Hi, my name is Pam, and this is my pocket guide. All right, so I just wanted to start off with the recommended adult immunization schedule for 2025, and then in the middle of this, I decided that I just wanted to add a little bit about motivational interviewing. I just think it's really important, especially in today's time where there is a lot of criticism and vaccine hesitancy. So I think it's good that providers are prepped for, say, anxious parents who have questions and very valid concerns. And if they're able to, foster, a good rapport with these patients and their parents, and are able to have an open mind and be understanding, ask open-ended questions, and are open to listening to these parents, I think that it would just make it a little bit easier for parents to be able to give their kids the care that they need. I also added the recommended child and adolescent immunization schedule for 2025. And then I added just the common antibiotics that we all use for pharmacology this year. I made a whole chart, as well as I found another antibiotic chart just to make things a little bit easier for me, and I think it would be helpful for me in the future when recommending and prescribing. Next, we go into my women's health section. I have the menstrual cycle, and here's like a visual guide. It just shows all the menstrual phases, and it just gives you a good diagram of everything and a good description. I also go into I also have a birth control guide here. It just talks about all the different methods, the uses and side effects. I also have another infographic that talks about pregnancy and how the baby is developing. I also have just a little bit of information about endometriosis and about the symptoms and about treatments and what can happen in PCOS. I think this is like a pretty good thing to add in, because I feel as though a lot of women have a lot of these signs and symptoms, but they don't really know what it actually is. So I think it's just good to actually be informed about it, instead of saying, oh, you probably just have a little pain, it's normal. But no, we can actually really get to the bottom of this and figure out what it is. And then I added a little bit about estrogen and progesterone. I also talk about the hormone therapy uses and indications. And also this is another bit that I added onto my virtual pocket guide. Just the update on breast cancer screenings and the recommendations. And then I go on to my cardiovascular portion. I always like a good picture that just labels everything. This is just the outside of the heart, and this is the inside. You see all the valves. And then this is just a little bit about initiating treatment for hypertension. And then I just have an algorithm here for chronic and stable angina. And then some recommendations and guidelines about heart failure. This is just an algorithm that I pulled from pharmacology, which I thought was very useful. And this here is about the RAS system and heart failure. Next, I just have a quick thing about heart failure medications, which was really helpful. And then this is just recommendations for the treatment of confirmed hypertension in non-pregnant people with diabetes. And then I go on to my mental health section. This is just a little bit, a little infographic that just talks about the neurotransmitters and antidepressants. And then I go on to describe the antidepressants, talks here about MAOIs and, you know, the factors, foods to avoid with tyranny. Then I have a little bit more about my antidepressants. And then here is an algorithm for treatment of adults with anxiety disorders. Here is the starred algorithm for the treatment of depression. And then this is just a chart that lists the extrapyramidal syndrome symptoms and antipsychotic medications, which was always a little bit hard for me to remember. So I think this will serve me well. And then this is just a section on derm and how to treat some skin infections. And this is just a picture about just the layers of the skin. This just shows a little bit of how to treat general superficial wounds. Talks about what infections would be treated with oral antibiotics or a topical medication. Here I added some pictures along with the recommended medications like ringworm and clotrimazole and miconazole. Just a little bit more. And then talk about corticosteroids here. Then I have some recommendations about mild acne and those recommendations. And this is another algorithm that I found about how to treat mild to severe acne. All right, and then next, I just have a picture of the anatomy of the ear. I also added some information about how to treat acute otitis media, how it would be diagnosed, and what antibiotics would be given, like amoxicillin, to treat it. And here is another algorithm that I found on how to treat a child with AOM. I added some other things that I thought would be helpful. Another algorithm that, you know, how you would diagnose and treat someone with peptic ulcer disease. I have another one about GERD. I have this, which talks about the comparison of gastric and duodenal ulcers, which is good when your patients are trying to describe your symptoms. Common locations of knee pain, which I think is good because as providers, you know, we're not going to be, well, most of us are not going to be very specific about, are going to know, you know, everything. So I think it's just good to have, so when your patients come in and they're describing their symptoms, they can point to like the location, and you can have a better understanding of what's going on with them and who to refer them to. This is just another algorithm about how to treat a patient with a suspected UTI. A list of common drugs and their interactions. Anti-hypertension meds. I added this. This is about diabetes medications and what and how you would decide if a patient is going to be on orals or if they're going to be on insulin, and how you would go about that. And this, I added vitamins just because there's a lot of them, and sometimes I end up forgetting which ones, you know, are good for what. So I think this was a good thing that I added. All right. Thank you. Thank you for listening to me talk about my Pocketguide. Thank you.